In this video, assistant of propedeutic of internal disease department, candidate of medical science, Razakbaeva Lashin Kurmangalievna demonstrate how to auscultate the lungs. First, explain the procedure and take patient permission for auscultation of lungs. Ask the patient, take the comfortable position. The best position is sitting on the chair with arms placed on his knees or standing. Main rules of lung auscultation are following. Room must be warm and quiet. For auscultation, we use stethoscope. Piece of the stethoscope must be clean and warm for the patient comfort. Auscultation must be carried out according to strict plan. Anterior, lateral, posterior aspect of a chest. Auscultation is start from lung apex, above and under the clavicles, gradually moving to downward and to the sides over second, third, fourth, fifth intercostal space. Then patient should put hands behind his head, and auscultation of axillaries is performed in symmetrical points by the same method. Examiner listens 1 to completed breathing cycles at each point. Then auscultate the lungs back in the similar order, and axillaries too. Patient must fold his arm in auscultation of interscapular region, opening that space. Our patient has normal breath sounds over the chest. It is called vesicular. At some points, we can listen to laryngeal tracheal breathing. Normally, bronchial breathing may be listened over the mammibrum sterni. 6th, 7th cervical vertebra, interscapular region. After auscultation, doctor should notice main breathing sound, vesicular and bronchial, and recognize additional abnormal lung sounds, coarse and fine cracks, wheezes, bronchi that indicate different pathological states.